Wow, folks, I just had a really great week. I think I actually recruited a new listener the other day. We're up to 2 listeners now. That's great! To my newest listener, I hope you love what you're about to hear. It's an all new Prove It To Me. Hello, everyone, and welcome to Prove It To Me. I'm your host, Dr. Matt Law. Today, I have a very special guest with me, so I don't want to spend a bunch of time rambling about nonsense or getting tangential like I normally do. I did, however, want to tell you that I just got back from this really great conference in St. Louis. Trust me, it wasn't great because it was St. Louis. This Floridian turned into a freeze dried human getting off the plane. I have never used so much conditioner, lotion, eye drops, and chapstick in my life just to survive a couple days. It was 1 degree Fahrenheit when I got in my Uber to head back to the airport this morning. Awful. No, it was because this was the National Safety Council's Future of EHS conference. What a fantastic time. It's a smaller conference, but it is hyper focused on evidence based solutions that seek to really move the needle on improving workplace safety. So much good content, so many great speakers, and so many of the most eager to learn attendees in the environmental health and safety space. Oh, and also, I got to nerd out with other folks about research and statistical analysis all day. Not only that, they were all about that kind of talk. At least they said they were. I hope they were. Look, if you give me runway, I'm gonna take it. And I took it. I loved every minute of it. Anyway, if and when this event comes up again, you all need to check it out. You won't regret it. All right, so we've got a really important topic to discuss today, and I'm so glad I was able to get this guest. I met her through the Society for Total Worker Health, and she is highly intelligent and very invested in research to practice when it comes to worker well being. My guest today is a double board certified physician specializing in occupational and environmental medicine as well as preventive medicine. She is currently Chief of Occupational Health at VA Long Beach Healthcare System. She also leads the Environmental Health Clinic at VA Long Beach Healthcare System, conducting exposure assessments for veterans, including Agent Orange, Gulf War, and Open Burn Pit Registry exams. She is Associate Clinical Professor in the Department of Occupational and Environmental Medicine at UC Irvine School of Medicine, as well as Associate Clinical Professor in the Department of Environmental and Occupational Health at the Wen School of Public Health. She is lead of academic and community partnerships with the University of California Center for Climate, Health, and Equity, where she is spearheading efforts to enhance academic and industry partnerships, evaluating new methodologies to enhance emergency preparedness surrounding climate-related events, working with community leaders on identifying practical climate solutions, and developing climate curricula for medical students and residents. She is currently pursuing board eligibility in Clinical Informatics through the American Board of Preventive Medicine's Practice Pathway. She is chair of the Health Informatics as well as the Environmental Health section of ACOEM and continues to lead the ACOEM Presidential Task Force on digital transformation through a Planetary Health Lens. She is also a certified medico-legal evaluator and qualified medical examiner in the state of California. Please welcome Dr. Manny Berenji. Manny, we had met during the Total Worker Health annual meeting for Society for Total Worker Health, and I know we're going to talk about that a little bit later. You've brought a really important topic today that I think we really want to dig into because there's a lot of evidence to support it. There's a lot of discussion out there, a lot of resources, but we're just maybe not tackling this as well as we can. And this topic is mental health in the workplace. So I would love to talk to you about what the significant challenges are right now about mental health in today's workforce.
Great. Well, thank you so much, Matt. It's a real honor to be on your podcast and really highlighting something that's near and dear to my heart, which is workplace mental health. I don't know if people realize this, but this is a global problem. I was just reading a research article that came out that was saying that up to 12 billion working days are lost every single year to depression and anxiety. I mean, just contemplate what that means. I mean, we're not talking like a couple of days, we're talking billions of days globally are lost to mental health conditions like depression and anxiety.
Wow.
And clearly, there's a ripple effect across the global economy. You know, if folks are not feeling good, they're having to take that day to take care of their mental health, they're not able to be their best selves at work. And we can see when folks are not feeling the way that they should be feeling, they're not going to be able to do what they need to do in the workplace, create, innovate, really try to move the needle on their respective in their respective industry. So I think from an economic perspective, we really have to be mindful of the ramifications of not taking care of our essential well-being, our mental well-being, because that's such a critical component of our day-to-day.
That's such an interesting thought because I feel like we do such a great job at recording all of these serious injuries and fatalities, or just serious injuries in general that cause lost work. And we consistently record that. We can find it in the Bureau of Labor Statistics, but mental health is not really something that's in that statistic. And I'm I'm genuinely curious why we're ignoring this as much as we are, if we are indeed, or we're losing productivity, we're losing those days that workers could be their best selves in the workplace.
Yeah, I think it's a multifaceted issue. We really have to kind of take a worldview when it comes to mental health. I mean, for centuries, mental health has always been something that has been stigmatized. Folks never really felt comfortable talking about their mental well-being because it wasn't something that was encouraged. In fact, it was actually shunned. So we've actually seen a major breakthrough in the last couple of decades to really shift the paradigm when it comes to mental health and being able to understand what may be causing someone to be feeling a certain way and to actually validate those concerns. And I think a lot of that validation comes from multiple sources. For most folks, it's from their families, it's from their friend network, but there's actually growing literature to support that mental health in the workplace and having a supportive organizational culture can really drive mental health and well-being for employees, no matter what your industry. I mean, I'm in the healthcare industry, and this is something that has popped up in numerous different facets of my work life, being able to take care of my fellow healthcare workers. And we just came through a massive pandemic where hundreds of thousands of us were working the front lines, taking care of injured and sick people, having this virus that we didn't know what to do with. And it took a mental toll on us. Like, I didn't even realize it, but I kind of was thinking about my COVID experiences on the front lines. And at least for me, I kind of had to suppress a lot of what I was feeling because I had to be present in the moment for my patients who needed me. And luckily, I had a really good family and friend network that I could lean on during those really tough times. But a lot of our counterparts didn't have that. And we saw a lot of people suffer emotionally, physically, and mentally as a result of all of these stressors literally coming on in a very short amount of time. So being able to create safe spaces for our fellow colleagues, especially in the healthcare industry, where we're seeing so much happen to our patients, and we start to kind of find ways to channel that fear and that anxiety. But if we don't have healthy ways to really approach this and really try to create environments where we can share without fear of reprisal, I think we're going to continue to see these alarming statistics. And I think this is where we in the employee health and well-being space can really make our marks.
So you mentioned this thing about stigmatization, and I realize that that is probably one of the biggest challenges around mental health and being successful with addressing mental health in the workplace. And I want to jump back to the solutions that we can use to address this, but talk to me a little bit about stigmatization. What is happening there, and what could we possibly do about that piece?
Yeah, I think stigmatization has a couple of different layers to it. I think a lot of it has to do with organizational culture, and things are changing on that front, which I'm very happy to see. But there are still organizations that really try to give resources and encourage their employees to seek the help that they need. But it's really more of a, this is kind of what you need to do. It's not really our issue.
Mm.
And I think there needs to be an integrated approach to how we deal with mental health. It's not just something in isolation affecting one individual. It actually has impacts to really the entire organizational culture. And being able to kind of see the bigger picture when it comes to mental health and not looking at it from a point of isolation, but from a point of how can we try to create a thriving work environment that nurtures and fosters innovation and really tries to create spaces for people to want to produce and want to really be a part of something bigger than themselves. I do see that change. I do see that change in mindset. And I think a lot of it has to do with the fact that people are really struggling. And when they don't show up to work, a lot of times there are so many things that are happening in their personal lives. You know, we have to look at these psycho stressors, these psychological, social stressors that really impact their ability to be present. And I think there are ways where we can create systems where workers can feel that they have a place to come to when they're having these concerns pop up. And instead of just saying, oh, it's going to be okay, listen to, this podcast or whatever, I think we really have to be intentional in how we create these spaces of nurturement, of growth, and wanting to better understand each other so that we can really pinpoint those issues further upstream before it spirals and turns into something that we really have no ability to manage because it's escalated to a point where none of us can really make an impact. So it's really about identifying those upstream risk factors, looking at what's happening in the day-to-day, and really trying to give supervisors and managers the tools that they need to be active listeners, to be present in their employees' lives, and to come from a place of concern. Because there is data to demonstrate that with supervisors and managers having that approach, being able to be mindful of what's happening in a respectful way, of course, and managing expectations, there are ways where we can give employers the ability to have some skin in the game and still be able to create those thriving work environments that can allow these organizations to continue to grow.
So I do want to real quickly clarify that this is not one of those podcasts. There's a lot of good podcasts out there for mental health. This is not one of them. We'll talk about mental health, but we're probably not going to fix anybody's headspace, to, as you could say.
They just came out with a study actually this past year looking at the state of the mind. So they actually were able to do these questionnaires, and essentially what they found was that workplace stress essentially has a negative physical impact on employee well-being. And up to 77% of the respondents in this particular study had stated that. So it's not just a mental to mental thing. It really has impacts on physical well-being, on spiritual well-being. I mean, to see how one or two little things can really start to have this domino effect where it really starts to impact so many different facets of a person's overall health state. I mean, I thought that was a really interesting statistic, and I feel like a lot of these companies, especially in the well-being space, are really trying to better understand what's happening out there. And researchers, folks in academia, they can do that as well. And being able to create those private-public partnerships, I think, is key to be able to advance the thought leadership and the necessary research to be able to make a dent in some of these mental health statistics that we're seeing.
This is actually a really good spot to transition into some of the things that we want to look at as far as solutions to the challenges that we have with getting mental health addressed in the workplace. And especially when we talk about the evidence-based solutions and the evidence that goes into supporting those solutions that we could use. So you mentioned some of that around the research that those folks are doing. What else is out there, and what kind of evidence is out there to support different solutions that we can use to address mental health in the workplace?
Yeah, so the Centers for Disease Control and Prevention Total Worker Health Initiative has really made some major headway in this arena. Over the last 2 decades, they've advanced thought leadership on total worker health, which essentially is an integrated approach to dealing with employee health and well-being matters, and really trying to develop those partnerships within an organization, from the C-suite to the front line and everyone else in between. And working in tandem with healthcare professionals, safety folks, folks from the mental health space, to really have a better systematic approach to dealing with health and well-being. And this paradigm has really been instrumental in my professional development. It really has given me structure to how I am able to do my day-to-day here in our occupational health practice, and being able to leverage our respective expertise in our domains, whether it be health, safety, or risk management. It really takes a village to do total worker health. And I think having that integrated approach really allows for a really comprehensive analysis of what's happening in the workplace, and really trying to create systems that work for employees, that work for employers, and really try to get to the root causes of some of the issues that may be ongoing in some of these workplaces.
Yeah, this is one of those things that's really attracted me to the world of total worker health. And I, I think it's something that needs to be more seriously looked at so that it's at the forefront of the minds of the leadership in these organizations, right? This is not just, we're not just looking at injuries and fatalities and the big hazards anymore. We're looking at things that are microscopic. We're looking at things that are affecting mental health. We're looking at things that are affecting the entire worker. And I think to your earlier point, these are all things that affect not just the safety and well-being of the worker, but the productivity in the workplace. And I think that's so important for us to be looking at a broader view of the health of the worker. And I do want to dig into that a little bit more. But when it comes to these solutions that we're able to put in front of employers, the folks who can really make the difference for their workers. How do we get these solutions to them? What are what are the methods that we should be using to get these solutions in front of the people who can make the difference?
Yes. So I'm a big fan of the data-driven approach. I always want to encourage organizations to really understand their employees. I think always doing a needs assessment, just better gauging the temperature of your organization is always a good thing. Being able to collect that type of information in a secure way can really provide insights as to what's happening within your organization. So I'm a big proponent of really being intentional when it comes to developing those surveys and really try to create surveys that really get to the nuts and bolts of what's happening. I know a lot of us like to use the multiple choice format, but don't shy away from the ability to have employees provide free text narratives.
Mm,
A lot of times, if you create those safe spaces where you really want to be able to create positive change in the workplace, having a survey that is well designed, is well meaning, and is intended to help develop a new way of addressing mental health in a non stigmatizing way. I think the messaging around that is so important. So I think really spending the time to do that assessment to better understand your workplace dynamics can really pay dividends in the long term because you can really create something that works for your organization. And I can't say this enough, really having good quality data is really key.
as a quantitative researcher, the free text thing is absolutely terrifying to me. But I get it. I think you're right. I think there is absolutely value to that. And we can and maybe that's one of the reasons why we don't do it so well is because it's a scary thing to implement. And it takes a little bit more work to get the information and the themes and the data that you need from a free text format to be able to do something about it, to figure out what you need to actually implement to create a solution around those different themes. It can be done. And I think to your point, we should be doing it, especially for this reason where it's not all clear cut. It's not all going to fit into a checkbox. It's something that is experienced different by every person responding to that type of survey. So yeah, I think that's an extremely valuable thing.
Yeah, and I think mixed methods research, I mean, incorporating the quantitative and the qualitative. I mean, I don't want to get super nerdy on this, but
Do it. That's what this podcast is for. Come on.
let's nerd out. I think having a mixed method approach really can yield some tremendous insight
Hmm.
because sometimes things get lost in the multiple choice. And believe me, I have this dilemma myself because I like to have hard data. I like to be able to have clean data sets, but data is messy
Hmm.
and life is messy. And if we're not able to find ways to capture that information and be able to, do that thematic analysis, be able to really kind of dig deep into what might be driving some of these trends, I think we're missing a major piece of this puzzle. So I think when organizations are looking for partners in this work, I think it's really important to understand how they develop their methodologies and making sure that they're not just using, a boilerplate, but really trying to understand the specifics when it comes to a particular organization's makeup. Every organization has different, it has people who come from all walks of life, all different strokes. And if we're just using, templated questionnaires, it's really not going to help better understand that particular population. So I think there's a way where we can achieve some balance in that and really trying to kind of think outside the box when it comes to collecting this information, because the more specific you can get and the more information you can actually tease out from your employees when they're filling out these surveys, and really coming from a place of well-intentioned curiosity, as opposed to just saying, oh, we have to do this. This is something we do every year. I think we really need to have a new mindset when it comes to these surveys, because it's an important tool. We acknowledge that, but at the same time, there is survey fatigue. So how do we kind of find innovative ways to get this information that really allows us to better understand what's happening in real time? I think that was a bit of a long-winded answer, but I've been thinking about this, and I really think we need to kind of figure this out.
Well, and my concern here is that a lot of employers, it's not like most organizations are employing researchers or anybody that's experienced at doing survey research. And if they are they experienced enough to look beyond what they've got with those templates or what they normally do with just, gathering the normal quantitative information? Are they able to look beyond that to get into this deeper stuff and get into the qualitative stuff that we need to really answer the question here? So for organizations that need that but don't know where to look to get somebody who can help them with that, what do we do? Where do we turn, or where do we send them to, get those kinds of resources?
So yes, so I'm not going to get on my soapbox, but I do kind of need to get on the soapbox.
Do it.
So I don't know how folks feel about point solutions, and believe me, we need solutions, but we really need to go to the experts when it comes to developing these types of methodical approaches, especially when it comes to mental health and well-being. The American Psychological Association has some really great content to really help provide education, especially for managers, employers, HR professionals, really trying to dig deep and really trying to be intentional in how they're approaching this. I think education is the first step, and that really begins with the organization itself, being able to better understand what's happening with the research. You don't necessarily need to be a scientist to understand a lot of this information because it's so relatable. We all work in a workplace, whether it's in a hospital, whether it's, at a university, like we all work for someone. So I think this really hits home for all of us to do that actual homework to better understand what's happening with a lot of these mental health assessment tools, being understanding that a lot of these tools have limitations, but you want to pick the best tool for your organization. And I think going to reputable organizations like the American Psychological Association, the American Psychiatric Association Foundation actually has a whole module on workplace health. I mean, this is amazing. Like, there's just so much good information out there. So I really encourage folks to just be curious, really spend the time to check these sites out, because there's a really good amount of high quality information that you can actually take back to your home organization and really start to do that deep dive about what may be driving some of the things that are happening in your neck of the woods. Every single workplace is going to have a different set of issues. And this is why we can't go to the cookie cutter platform. We really have to do the work, understand what the drivers are, understand what's happening with our respective workplace cultures, And then from there, you can really develop strong programming that can really start to address some of these issues that for the longest time we've been trying to wrap our heads around, but just never really had a systematic approach to do so.
One of the conversations that you and I had had a couple weeks ago brought up this piece about the messaging that employers can use around this topic. How do we make sure that employers have the right resources to make sure that that messaging is as good as it can be for their employees? And then I'm actually going to combine the other question that I had with this. What are the risks around that? I mean, how do employers feel comfortable navigating around the risks associated with messaging? Because honestly, I think a lot of employers are almost scared to put out the wrong message or to not have it tailored specifically for their workers in a way that's going to be meaningful. So, what do we do there? How do employers navigate this messaging thing around this topic?
Yeah, this is a really important area, and this is something I deal with in my day to day. Communication is such a vital tool. And I mean, a lot of us don't get trained in how to do this. I wish we did. But you're right. I mean, how we actually are able to disseminate information to a set body, in this case, employees, and making sure that it's understandable, it's clear, it's accurate, and it's actionable, that people can actually take something away from the messaging. I think it's more of an art than a science, but we clearly want to make sure that we have the facts straight. And I think this is really where having good sources of information to provide those bullet points for the facts, letting the facts be able to tell the narrative, and then creating the messaging around those facts. As long as we don't lose sight of that, in my experience, getting through COVID, having to literally put out messaging within, a couple of minutes. I got really good at doing this because we had to.
Mm-hmm.
And I would get real-time feedback from my fellow counterparts if the messaging wasn't sticking. So, I mean, that was a extenuating circumstance because we were in a global pandemic at the time. But I actually learned a lot from my colleagues to be able to create really good sound bites that are concise, that are clear, that get the message across and leaves no room for ambiguity.
Yeah, interesting.
But it's an art, believe me, it's an art. And I highly encourage folks to really create a team, a communications team at your organization consisting of various different stakeholders within your organization to make sure that your messaging is factual. It is based on the latest evidence. It is clear. It's understandable. It's not super jargony.
Mm-hmm.
I mean, I just learned just by example because I had to. But I think really understanding the art of communication in this day and age, especially around something like mental health, I think it's a worthwhile exercise to embark on because it really will have long-lasting impact to the organization as a whole.
Yeah, yeah, absolutely. There definitely is an art to it, but I don't think it needs to be a scary, daunting task. I think there are good ways that we can, or good things that we can put into place to make sure that we are putting out the right messaging. It's evidence based, it's not too jargony, to your point. It's understandable by those who are receiving it. So there is an art to it, but the worst thing we could do is not put out any messaging around this because we absolutely have to address it. Okay, so we've talked a little bit about the research that has gone into this, and I want to go back to the fact that this is a research podcast. We talk about evidence, we talk about data, we talk about the things that are out there that are moving the needle on real problems because we have evidence to back those solutions up. Now, I think we've already talked about your relationship to research, especially related to this topic, in that you are very much a practitioner when it comes to putting research into practice. And to be honest, this is one of the gaps that we have right now is that there's all this research that's being done, there's all this practice that's being done, and for some reason they're siloed and not enough of the evidence-based solutions are making their way into the practice world. So tell me about your experience in with research to practice in general. What are the challenges? Why are there disconnects here? And what could we possibly do better?
Yeah, I think this is something that a lot of us in the medical community face every day. I pride myself as being a translational scientist as well as a physician because by pure virtue of what I specialize in, occupational and environmental medicine, we are well trained to translate evidence into practice. That is literally what we do. And I feel like I've been given that platform to be able to do that for a variety of different workplace related matters. I mean, COVID is the prime example I can think of because we literally had to take information coming from the CDC, from clinical trials, looking at vaccine efficacy for these mRNA vaccines. We really had to do the assessment, do the deep dive on the actual data, try to be able to really understand what the data was telling us, and then literally translating that into direct practice in a fairly rapid fashion. I'm just thinking about that time and how we were able to mobilize our clinical departments to start accelerating the advancement of these vaccines and being able to demonstrate that this was, at the time, this was really the right thing to do because we wanted to minimize potential harm to the greater population at large. And with the evidence that we had at that moment, we had to be able to make those decisions fairly quickly. So really trying to take all of those data points, distill it down to the nuts and bolts, and then creating clear, succinct messages to our respective stakeholders, whether it be employees, whether it be patients in my case, being able to make that evidence-based linkage between getting this particular vaccine and being able to demonstrate that it actually can curb the potential for a hospitalization or, God forbid, death. I mean, this is what we were dealing with at the time. And you have to be able to look at the information, look at all the evidence, synthesize it, and be able to make those inferences pretty quickly to be able to mass disseminate that information to the greater audience. So, I mean, just looking back, I think being able to work at that speed, I don't know how I did it, quite frankly, but sometimes necessity is the mother of invention. And you really start to get into that mindset where you really have to get that information, process it quickly, make sure that you have a brain trust of scientists, physicians, clinicians that you trust, that you can actually confer with and make sure that you're on point. Like to me, that brain trust was everything. Like having that group of people to really make sure that you're on point, that you're reading the information the way it was intended, and being able to confer with your peers. To me, that's the beauty of being in our field. And I can't think of a better example than that.
Yeah, yeah, absolutely. In your mind, and it seems like you've had a really great, well, it in a situation like the pandemic, it's the experience is harrowing, right? But it sounds like you've also been able to do really good work in being able to translate that research and put it into some sort of meaningful practice that's going to actually make a difference in the health and safety of people. What could researchers who are publishing this research, who are doing the science, who are actually pulling this data out, what could researchers do better to make sure that good research is making it into the hands of people who can put it into practice, in your mind?
Yeah, that's good. I think really at the end of the day, we need to be disseminating this information to the right audience. And I think that has to do with journal selection, where you present this information, how you're publicizing the information, and really being mindful of your audience. A lot of researchers, they want to be able to send this information out to the greater ecosystem. And I think that really should be the ultimate goal because at the end of the day, if that information is out there, people can actually get that information, they can process it, they can distill it down. And quite frankly, the beauty of these research papers is that you can reach out directly to the authors. I mean, there is a contact there. So, I mean, I'm a kind of person that if I have questions about a particular methodology, or if there's something that I want to be able to utilize in my respective practice, I tell people not to be shy. The contact information is there for a reason. And I think really trying to encourage our peers, especially from the non-scientific community who may potentially feel intimidated or may feel like their question may be, maybe it's not the right question. I think we really need to be inclusive of folks from the non-scientific community to be able to have those exchanges in a safe platform, to be able to allow for that exchange of open ideas, and to really allow for practitioners, especially, the ability to really ask those deep questions about how this is going to impact their particular patient population or worker population. So I think it's a two-way street. The researchers are doing their job. They're getting the research out. I think it's really up to the person reading that research to really be mindful of what they want to achieve. And if they truly want to be able to implement some of those practices, they really need to take that extra step to do the outreach and to really start building those partnerships. I mean, a lot of times just sending that email, that really can open doors to potential collaborations, really trying to create new ways of applying that information in a way that maybe the researcher didn't intend. So I think creating those open communication streams and allowing for that bidirectionality can really produce great outcomes and create new ways of approaching a lot of the research that maybe folks had not intentionally thought of. But this is why we want to be able to get the information out to as large of an audience as possible.
Yeah, I actually, just pulling from those thoughts, I think it's important for organizations or anybody who's looking at that research to remember that the researchers themselves are hungry to do more on that topic. So if you can provide them that opportunity by reaching out and asking for some sort of collaboration, hey, hey, Mr. Researcher, I love that you've explored this topic. We're having this exact problem in my workplace. Is there any way we can collaborate on this, to dig deeper into this problem and maybe come up with a good solution based on the data that we find? I, you know, I I think there's a great opportunity for collaboration there that I think a lot of researchers would be excited to get involved in. So before we close out for today, the last thing I want to talk about is this concept of total worker health, which I said is extremely exciting to me, and I know it's exciting to you. So tell me about total worker health. This it's not new, but it's relatively new to, compared to the way that we have traditionally been approaching workplace safety and health. But, I think a lot of people are curious about it. They want to know what's going on with this total worker health thing. So tell me about total worker health and what it means to you and your work and what makes it special.
Yes. So total worker health in a nutshell is really just a multidisciplinary platform for us to create a culture of well-being. I mean, that's kind of how I look at it. We have our health professionals, we have our safety professionals, we have our HR professionals. We're really kind of in this together. We each bring our unique skill set to address the issues at hand, which has to do with how do we create thriving work environments. And I think we all can agree that we want to create those thriving work environments. And if there are ways where we can band together to create that systematic approach to tackling some of these issues that we face as a collective and bringing our respective expertise and providing those perspectives to tackle the issues of our day, to me, that's the beauty of total worker health. We're trying to break down those silos. We're trying to create these spaces for meaningful engagement to really identify those root causes that a lot of times, we just kind of sweep under the rug, or we don't really make the bigger connections to the bigger picture. So to me, total worker health is really creating those communication streams between various elements of the workplace enterprise to make sure that we have the ability to communicate in real time, to be able to articulate, what we're seeing on the ground, and creating those forums for those discussions. To me, I think having dedicated time and space to be able to relay what we're seeing in our respective niches or respective areas, I mean, to me, that's what makes total worker health it's really an organizational mantra. It really should be the driver for workplace engagement, really from the C-suite down to the front line and all the way back. And I think if we're able to encourage, especially those folks who are coming from positions of senior leadership, to really understand the basic principles of total worker health. It's not just looking at, DART rates. It's not just looking at, this dashboard of workplace injuries. We got to let the numbers really tell the narrative, really trying to put a human face on some of these things and really trying to understand why sometimes we're kind of seeing things anecdotally, but we don't really know why things are happening in a particular department or in a particular unit. And to me, being able to have those abilities to create those spaces for open discussion, to really do the systematic deep dive to better understand why these things are happening, and applying some of these business principles like Lean Six Sigma and some of these business practical frameworks to help us redesign some of the structures that we have in place and to reimagine how we actually work to be better at what we do. I know that was a bit of a long answer there, but I feel like total worker health is not just some abstract concept. I think everyone out there is doing a little bit of total worker health. They just never really thought about it that way. But it's really trying to create that integrated approach to creating thriving work environments. And if that's what connects with this audience, to me, that is essentially total worker health.
Okay. Yeah. I'm 100% on board with everything you just said. I think it's great. And I think it's a great concept for folks to explore a little bit. So, Manny, you've been kind enough to give me some great references, linked resources that I will definitely include in the episode notes for folks to learn a little bit more about the topics that we've talked about today. If folks want to learn more or if they want to reach out to you directly, are they able to do so?
Absolutely. I would welcome the conversation. I think this is really just a starting point, but I think really trying to leverage a lot of the expertise and real life knowledge that's out there and creating platforms for discussion and innovation in the total worker health space. We need the best minds to really tackle some of these problems. So I highly encourage anyone who has resonated with a lot of the topics today to reach out, and I'm happy to continue that conversation.
Awesome. Well, I definitely appreciate you joining me today, Manny. I think this has been an excellent conversation, and I think this is something that a lot of folks are going to get a lot of value out of. It is happy hour here on the East Coast, so I think this is a good time to close up for today, but I really appreciate you joining me.
Great. Well, thank you so much, Matt. It was a real honor to be here.
I really enjoyed that conversation. Manny is so easy to talk to, and what a great resource for understanding more about mental health in the workplace. If you want to learn more, I highly encourage you to reach out to Manny and definitely check out the resources in the episode notes. There's a ton. If you didn't know anything about mental health in the workplace before, you're going to learn today. Hey, this is also probably a good opportunity for me to shamelessly plug the Society for Total Worker Health. I do love this group of folks, and I love the multidisciplinary approach to addressing the entirety of safety and well being for our workers. And if you want to talk about research, there's a ton presented by this group all the time. You can learn more by visiting twhsociety.org. All right, folks, it's been a fun week, but a long week, and I think I'm going to take a nap now, for my own mental health. I'll get back to those emails at some point. Until next time, I'm Dr. Matt Law. I hope you enjoyed this episode of the Prove It To Me podcast as much as I did. Take care and stay safe, everyone. Prove It To Me is produced by me, Matt Law. Original music by Wes London. You can find this podcast on Podbean, Apple Podcasts, Spotify, YouTube, Amazon Music, and iHeartRadio. Like what you've heard so far? Please like, subscribe, and follow wherever you get your podcasts, and leave a 5-star review on Apple Podcasts. Got questions about what we talked about or research that you want to share? Send an email to contact@proveitpod.com. The views and opinions expressed in this podcast are those of the host and its guests and do not necessarily represent the official position, opinion, or strategies of their employers or companies. Examples of research and data analysis discussed within this podcast are only examples. They should not be utilized in the real world as the only solution available, as they are based on very limited, often single use case, and sometimes dated information. Assumptions made within this discussion about research and data analyses are not necessarily representative of the position of the host, the guests, or their employers or companies. No part of this podcast may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, mechanical, electronic, recording, or otherwise, without prior written permission of the creator of the podcast. The presentation of the content by the guests does not necessarily constitute an active endorsement of the content by the host.